Well, HealthyState.org reporters around Florida are always looking for what's new in medicine. Let's check in now with Dalia Colon for that story.
Each year, more than 500,000 babies are born premature. That's 1 in 8 babies. Now, a group of doctors in Orlando aims to help sick and premature babies to thrive through the use of electronic medical records.
This is Hayden Slater, and he's 14 weeks old almost. He was 1 pound 7 ounces when he was born. It was really scary because his skin just hung on his bone, and he really didn't move. It would be a lot for him to lift up his arm because he was so tiny.
The 100,000 Babies campaign is a quality improvement initiative for NICUs across the country to improve the quality of care for the babies we take care of. This is looking for the promise of electronic medical records and data warehouse information. It covers potentially about 20% of the neonatal intensive care units in this country. We'll have a look at Hayden. Hi. I'm listening to his heart and his lungs. And I'm listening to his abdomen, and I'm watching how he behaves. And doing well. Okay, young man, we're going to let you be. And we're going to put some information in the computer. All of this information is collected by this program. And it allows us to do our daily note and at the same time collect information for a much broader look at what goes on and what our outcomes are.
We identified 5 different areas that we thought needed work, one of them being decreasing the risk of central bloodstream infections that were related to catheter insertion. These infections are very dangerous for premature babies because they are immunosuppressed to begin with. Most of their infections are introduced through the skin. We cut open into that skin, or we break the integrity of the skin every time we put an IV in.
It's kind of scary when you see your child first come out and they have the cannulas, they're really red, they have IVs, and it's just a very scary experience, but the nurses here make you feel comfortable, which is awesome.
So with the central catheters, what we choose to do is avoid the continuous IV insertion because these catheters can stay in for weeks, even months if they're properly taken care of without an infection.
Every one of these blood infections prevented, you save in costs about $10,000. So this makes economic sense as well as you want to save the patients from having bloodstream infections. Catheter-related bloodstream infection area, we've been able to reduce those infections by 36%. We had set for ourselves a 10% reduction goal. We've done better than that. We expect in the next 2 years to drive that rate lower.
The difference between this campaign and other campaigns is we're dealing with babies. That is a very emotional subject for everyone. We know what needs to happen in order to be successful with the 100,000 Babies campaign. But now we need a number of participants that is large enough to show and demonstrate the results that will truly signify a very successful venture, ongoing.
It's kind of scary the first time you leave your children, especially being a new mom, and not knowing what's going to happen or what you're going to do or how the babies are going to do, being so early.
He's overcome a lot. He can listen to music now. Before we had to be very, very quiet in case he was in that deep sleep. I know it's okay to leave him. He's going to be okay.
Beyond reducing infection, the campaign also focuses on medication, nutrition, and reducing the time babies are on ventilators.